November is Antibiotic Safety Month, and who better to walk us through all the safety advice and general reminders about how to properly use antibiotics, or if we even need them at all, is Sanford Health's Dr. Stephanie Hansen, our favorite doctor in-house here. Good morning. How are you?
Good morning. Thanks for having me.
So we were just talking in the breaks. Antibiotics, a lot of people take them or have taken them in the past. And so when is it appropriate for you to prescribe it to a patient?
Well, first, I want to just get out there. We need antibiotics. They are life-saving medicines, and there are definitely conditions where you really have no other options. So I don't want to give the message that we should never be taking antibiotics or ever using them. That's one of the greatest inventions in healthcare. But there are many times when we don't need antibiotics, and that's really what I want to drive home to people.
And so when is a time when you say, yep, this is appropriate for antibiotics, and when you say, nope, sorry, not this time?
Well, I think it's important to recognize the difference between bacteria and viruses. You know, both of them cause sickness. Both of them can cause really severe sickness, but only bacteria respond to antibiotics. So if you have a bladder infection, if you have pneumonia, if you have strep throat, like we were talking about, you need antibiotics. And that's something that you can talk through your physician with. If you have a cold, if you have influenza, if you have a stomach bug, antibiotics not going to help you in that situation. Now, the in-between zone that we don't really talk about is that a lot of cases of sinus infection, bronchitis, and even ear infection don't always need antibiotics. And so this is you got to talk that over with your provider, understand what your symptoms look like. There's times where antibiotics might be helpful, but more often than not, they probably aren't.
And so we've been hearing more and more recently that they're antibiotic resistance. A lot of people getting concerned about that. So can you just explain overall what it is and what your role as a doctor is in preventing that?
Yeah. So when you take an antibiotic, one response that bacteria have is they can build up a resistance to that over time. And that can actually be really dangerous because then you develop this strain of bacteria that you can't treat. And it can cause some really terrible sickness and leave you with no options. So the more we inappropriately use antibiotics for things like colds or flus or that sort of thing, the more likely we are to develop that resistance.
And create, isn't that what they call the superbugs?
Superbugs.
Oh yeah, you don't want to, those are bad things. Yeah. And so if you do get an antibiotic because your doctor has decided it is an appropriate course of action, a lot of people might say, I feel better already. We're going to put the rest of these in the medicine cabinet.
That's actually one of the worst things you can do because that's the situation where those bacteria can really develop resistance. So if you are prescribed an antibiotic, it's important to follow the directions exactly. So what your doc told you to do, do it, even if you're feeling better. Don't save your antibiotics for later. I hear from a lot of people say, well, I had some old amoxicillin in my cupboard, so I just started it because I wasn't feeling good. Not a good situation to do that. And then I also recommend not sharing your antibiotics with someone else. I know it's tempting if another person in the household gets the same illness, but there might be reasons where your medicine is not appropriate for them.
Yeah, of course, leave it up to the trained physicians and providers who can help you. And another thing, when people are on antibiotics, I'll just say this with me personally, my gut, it gets ruined. What can people do to feel a little bit better when it comes to their gut health?
Yeah, antibiotics come with side effects, and that's another reason we try to be judicious in their use. So things like upset stomach, diarrhea, skin rashes, allergic reactions, which can be serious. I mean, these are not medicines to mess around with. If you're looking to protect your gut, again, following the directions exactly, doesn't hurt to take a probiotic supplement or eat probiotic-rich foods. Sometimes it's just one of the things that comes along with taking those meds. One
of the side effects to get rid of something else that's causing you a lot of pain. Okay, and if anyone has any questions, is this a virus, is this a bacteria, what would you recommend?
Absolutely reach out to your provider. They can help kind of walk through that with you, understand your symptoms, and help decide if you need an antibiotic or not.
Okay, and I think wonderful thing with telemedicine, they should be able to do that pretty easily now.
Yeah, you know, you should log into sanfordhealth.org or log into your MyChart account to see what options are available to you.
Okay, love that, doctor. Thank you very much.
Thank you.
Coming up here on today's show, we are getting creative with guest John David Berdahl. Stick around.